Hello, 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 you wonderful world out there, and welcome back to the Sex, Drugs, and Jesus podcast. How are you today? I hope that you're doing really, really fantastic. I have with me today the good Dr. Paul Gittens. And well, y'all, we're going to be talking about a lot of sexual things today, sexual medicine for men and women, fertility, erectile dysfunction, cr- just a lot of things to do with sexual health. Dr. Gittens, how are you today?
I'm doing great, Devan, and thank you so much for having me on the show. It's Friday. I've been waiting all week for this, so I'm excited to be here.
Yes, it is. This is a great way to round out the week talking about sex.
That's right. You go right into the weekend, right?
Yeah, people have that thing with on their mind. They be like, it's Friday, I'm gonna get laid, or whatever the case may be. People, the stress begins to relieve if they're married, then maybe they'll actually take their significant other out and do something romantic because
Yeah.
they don't have the burden of the week and everything like that to hinder them in their mind. So I suppose I'd do that. I'm a diehard romantic. I'm gonna get married one day.
Mm,
Gonna-
mm.
I'll invite you to the. I'll invite you to the. It really won't be a wedding. It's gonna be a kiki, really. It's just gonna be a whole Sagittarius level turn up.
There
And
you go. I could wear my like Hawaiian shirt or something like that, and then like a grass skirt. Just have a good time.
let's just have you a good ass time. Period.
Well, make sure I'm going to hold you to it. Don't let me, watch the podcast and say you're married and you didn't invite me. That's not cool. All
Okay,
right.
it'll be years
All
after
right.
that man or woman or trans or whatever. It'll be years because
All right.
I say all that. I be saying all this stuff I'm not gonna do when it comes to dating, and then there I am at the club.
Yeah. I mean, that's how it happens. It's one of those things where you say like I've signed off to it, and then somebody just comes and hits you right on the head. And that's how it always happens.
There I go back in love again, child.
That's right. That's right. It's all those receptors, all those dopamine highs and everything like that. It's great. It's a good place to be in.
I'm ready. I've been like in isolation pretty much the last 2 years. I divorced a covert narcissist 2 years ago. That's what led me to New York. Well, the Holy Ghost led me to New York, but it was that led to all the mental breakdowns and stuff like that. And I went into closed off from sexuality and everything. No dating, no sex, no nothing. But the spirit is now calling me out of that because she wants me more accessible. So it's time for me to get out there and start doing some mixing and some minglings.
Yeah, I mean, I think it's important. I mean, sometimes you go through a breakup and you just have to kind of get to know yourself again. It's start to kind of have a mental break and just to kind of meditate and then you move forward and then like you said, like whoever's calling you, they called you, you're coming out and you're ready to go.
Yeah, I'm ready. I am ready. And so you're ready, New York. I'm gonna be seeing a lot more of me here shortly.
You got to wait till it gets a little warmer out. It's a little cold out there right now.
We
It's like yeah, I was there yesterday and I think it was like 16 degrees or something like that. So, or you just make sure you wear a warm coat, all right? Because I don't want to see you on the streets, freezing in a corner or something like that. Make sure you're wearing something warm out there.
well, the first thing about being a New Yorker is you must not be afraid to layer.
That's right.
And so I try to go places that have a coat check. So no matter how many layers I come on, I can just take them off, give them money. And because when you go in there, the temperature is going to be set on hell. So
Yep.
it's 9 degrees outside, but it's 90 degrees anywhere you
That's
go.
right. That's right. That's right. You got to do your homework.
Like routine, getting dressed to leave. Then when you get to the club or wherever, they got to take it all off. And it's a whole thing.
That's right. That's right. So,
Okay, I'm going to read Dr. Gittens' introduction because it is so like well written. He does so much just so you can get his expertise and frame of reference. And then I'm going to read from Huffington Post a snippet of like an interview that Jimmy Kimmel gave, and I'm going to talk about why I pretty much disagree with it, and then we'll go from there. And the article that Jimmy Kimmel was talking about is about masturbation. So, but first, Dr. Gittens' introduction. So, Dr. Gittens is a leading sexual medicine and male fertility specialist and board certified urologist with practices in New York, the Lehigh Valley, and Philadelphia. He treats men and women from across the country and internationally. He focuses a wide range of elements from low sexual desire, pelvic pain, pain with intercourse, and anorgasmia for women. He also treats ED, chronic testicular groin pain, low testosterone, and premature ejaculation for males. He is an expert in male infertility and treats men with advanced hormonal therapy, microscopic vario. How do you say that?
No, varicocelectomy. Yeah, it's just that's all the male infertility stuff that I do. Um,
Variococelectomy. Okay, I like that.
yeah.
Be a good word challenge. Variococelectomy.
You got to spell that forward and backwards.
And or performs he also performs testicular extraction for in vitro fertilization. He also performs procedures such as microscopic vasectomy reversal, penile implant surgery, the no scalpel vasectomy, and microscopic nerve denervation for men with chronic testicular pain.
Yeah. We also do a lot of girth enhancement as well. So for men that want to increase the girth of their penis, so we do a lot of that as well. So it's a number of things that we do.
Okay, so wait a minute. So before we get on Jimmy Kimmel's article about masturbation, if somebody want to make their dick thicker, what are you
Mhm.
doing? Are you going in there? What are you injecting? How do you do that?
Yeah, so we do it very carefully. It's an off-label treatment. So we use filler. So the same filler that women will use for their face or men will use for their face to increase the volume in their face. So it's hyaluronic acid. So we'll carefully place that between the skin and kind of the area of the penis to give them have these guys have a little more girth, right? So we turn that like that small carrot into maybe a large pickle or an eggplant or so.
Oh,
So
not the eggplant emoji.
that's where it came from. I think it originally came from the penile girth procedure.
Oh
But we
my.
do a lot of those. We do them very carefully. We do, guys are really satisfied with their penis afterwards. It's great. It's nice to see someone that comes in that has some insecurities about the size of their penis, and it's a quick procedure, and so they see the difference right away. So it's one of my more favorite procedures I do in the office.
When you say off label, does that mean like not FDA approved?
So for the girth enhancement, so we do a number of those procedures, and so we use filler. And when we say it's off label, that means that the filler is used for the face. So it's FDA approved for the face. There's no FDA approved fillers for the penis. So we just take the filler we use for the face, we use it for the penis. It's very safe. And we allow guys to get thicker, fatter penises. It's fantastic.
So does it feel numb? Because like I'm asking that because in order to have like I guess a relation to like gravitational pull or spatial relevance. So if I'm gonna insert my dick
Mhm.
inside of something and move it around, I gotta be able to have a sense of like space and time.
Yeah, yeah, yeah.
Does that fuck with that? Does it change that?
No, no, I mean, if you go overboard, obviously, I mean, you're gonna have some decrease. You're gonna have some numbness of the penis because it's gonna be filled too much. But in general, when you do it properly and we keep our expectations to the point we just want a thicker penis and we don't need a Coke can, right? Then we're gonna, your sensation is gonna be the same. The look is gonna look great. And like I said, the majority of guys are really happy with it.
Do you measure like before and after?
Yeah, we take pictures and we do pictures at different angles and everything, and we talk about expectations. Obviously, if a guy comes in and he says, "Hey, listen, doc, like I want my penis the size of my leg," I'm going to say, "I'm probably not the right guy for you, right? You may want to go somewhere else because, I want it to look good. I want you to be happy with it, but we don't want to look for it to look like deformed. And so we take before and after pictures and we talk about like expectations. We talk about how much we want it to the girth to be, and then we go from there. And I always say, listen, let's start slow. We can do it in stages. We'll see if you like this. And then from there, we can always add more. So it's great.
What's the largest like change? Like give me the before and after. If he went from this many inches of girth to this many.
So, I mean, it really depends on like how much we put in, right? Like I said, I'm not the guy that will keep on saying yes, 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 more, more, more. That's just not me, you know? So we want to make sure we keep our expectations that, all right, it's going to look like like a normal penis, but it's going to look really good. It's going to feel good for you, and it's going to feel good for your partner. That's the goal, you know? And so, you can go from, you can go up a couple inches. So and that's in girth. So that's a good amount. So, it depends on it also depends on where you're starting at, you know? There's some guys that are starting with not as much, and so we make it look so they have a little bit more, so they feel more confident when they're, with their partner, or they just feel more confident walking around Manhattan, and they just, their heads up a little bit more, and they just feel better about themselves. It's great.
Do they have to come back in a certain amount of time to get it redone? Does it wear off? Does it fade away?
Yeah, so I always have my guys come back in 2 weeks. I think of every penis that I fill as my own, and so I want to make sure it looks really good, right? So they'll come back at 2 weeks. We do a follow up, and we'll say, all right, well, do we need to do a touch up here, or do you want more, right? Or are you happy? And I would say the majority of guys are happy after their first one. They just love the way it looks and feels, and so does it last? So I would say that, for filler for the face, when you place it in the face, either in a male or a female, it probably lasts about a year, year and a half at most. The filler in the penis lasts longer than that usually, because I just think because you're not using it as much as kind of moving your face all the time. So I have guys that come back that, even after 3 years, it still looks really good. Where there's some guys after 2.5 years, you probably got to do like a little touch up. So it depends on how your body metabolizes that hyaluronic acid, that filler.
I'm so happy that these dudes are feeling better. But on the other side of the coin, I'm like, where did this low self-esteem come from? Because if we lived in a world where we didn't know what nobody else's dick looked like, if there was no porn, sleeping around with a whole lot of people and seeing all of these different bodies, I
Mhm.
really think that we would have this. There's something wrong with me, or I need to be better in the first place. And whether you had a 2-inch dick, an 18-inch one, or not, you were point 0.5 inches around or a Coke can, you wouldn't care because you wouldn't know.
Yeah, I mean,
Where
I think in the
where
perfect world, that's how it would be, but we are in a world of where, like, you have 60,000 people or so looking at this podcast, right? So, we're in an audio world, and in the perfect world, everybody would look at themselves and feel like they're perfect, right? Everybody would say there's no insecurities, but, unfortunately, we don't live in a perfect world. And I think it's, when I see my patients that are interested in girth enhancement, I question them and I ask them, I'm like, why are you here? And if it's something that I feel is pathologic, I'll say, listen, like, I'm not the right guy for you. If it's something that where I feel like they're trying to compensate for something else, or if it's a mental problem that they're having, then, I'll say no, or I'll say, like I said, I'm just not the right person for you. But I don't feel though that it's any different from somebody like cutting their hair or getting breasts done or whatever it is. People want to look better, they want to feel better, and I honestly think there's nothing wrong with that. I honestly, people want to drive a better car, or they want to, wear better shoes or whatever it is. But if it is pathologic and if I pick up on that, then I'll be the first person to say, "Hey, listen, like let's hold back a little bit." That's everybody knows. I've been around. I mean, I've been running my own practice for close to 10 years now, and I've been around a lot of people, and people know that when they come to me, they're coming to someone that really cares about them and that wants the best for them. So, and that's the only reason I've been around. You see, sometimes you'll see these sex clinics that open up for 1 year, they close in year 2 or 3, right? And I just think it's a quality thing. You got to care for your patients, and you figure things out on the way there.
Well, at least you're bothering to give a damn about what's going on in the heart and the soul, because there's never any separating, heart, soul, and spirit from whatever it is that we do. And then in any aspect of life, and especially in healthcare, as a massage therapist, I've been a licensed massage therapist for like 7 years. It's not always about the massage, you know.
Mhm.
people come for the one thing, but really it's because of the emotional thing behind it. And even though we might not be psychiatrists, we still have to, like you said, pay attention and read those signs and really get into that and see what's going on. So I'm happy that your practice is not shallow and that you're really, really taking the time to care about the person, like the whole person setting in front of you and not just selling, people everything they want to buy and being sure that it's not going to hurt them.
No, I mean, that's the tenet of our practice, you know? I think that's it, and you're right, people, they may be coming in for one thing, but they're maybe their subconscious has brought them in for one thing, but it's really something else, and so you have to really pay attention to all these little details if you're gonna do it on a high level, you know? We hope, I hope we've been doing it on a high level for all these years, and so we pay attention to these little details. Like for me, like even the way a person comes into the office, or I usually greet them. Yeah, I usually have some time, so I'll go out into the lobby. I'll bring them back into my office, and I do that not just because I want them to feel welcome, but just also I like to kind of meet them in their environment and kind of see how they're walking or how they're talking, if they're nervous, if they're not nervous, or whatever it might be. And you got to pick up on cues, especially when you're doing something as delicate as sexual medicine. You really have to pick up on the little things. Sometimes it's more of what they don't say and how they're kind of speaking, or if they're speaking soft, or if they're speaking loud, or if they're making like little tick movements or what have you. You got to pay attention to all these little things in terms of really trying to be successful in what you do. And just like you as a massage therapist, you pick up on these little things, right? You pick up on little like movements in the back, or if there's tension or something like that, and you can ask them these questions because you've been doing it so long, and you're so great at what you do.
Oh, thanks, Doc. And you're the best. You're the best. I actually am going to refer one of my friends to you. This is how the Holy Ghost works. I was just talking to her today and she was supposed to come see me and she couldn't because she has like this chronic pelvic pain thing that's
Hmm.
going on. And I don't know that her doctors here in New York I don't know they're really hitting the mark. And so I don't think it's any coincidence that I'm talking to you now and that's something that you have experience in because she's been struggling with it for a while. And so I'm definitely gonna send her your information because and all of his information will go in the show notes so that you can contact a good doctor and find out. And so and I just love that I'm very excited, that you have that so it's sexual, but it can go deeper than that because if somebody is like, say, with her case, chronic pelvic pain, that could be coming from anything. Her doctor's saying it could be like a cyst, they don't know, and all of that going on for such a long time. It's time for a new point of view, for another opinion.
Yeah, I'll be happy to see what I can come up with for her. I would be very happy for that. It's just, especially when it comes to chronic pain, or it's so debilitating, and it can really affect so many different parts of your life, right? I mean, like you said, sometimes you can't get out of bed, or your levels of or pain are so high that you're depressed, or whatever it might be. So it's something that you usually want to do like a multi-pronged sort of approach, and make sure you're having somebody that you can talk to. I'm sure you're a great friend, but also having someone like a therapist that she can talk to, in the times that she needs that, and then maybe somebody for a pelvic floor, or somebody that's actually treating if it's some issues with the vagina itself or whatever it might be. So but a team approach is always kind of the best approach, I find.
Mhm. In that case, yeah. And then they call in somebody like me for the spiritual stuff, and I'll be like, "Okay, now let me look at these meridians and these chakras and see if we
Mhm.
have any energy blockages going on, let me do my whole shamanic thing, let me pray, let me lay some hands, and then we have it. Then we really have the full spectrum."
And you have the full spectrum, right? You can't forget about that. I'll tell you that. You cannot forget about that.
You're like, "Let me see what the Holy Ghost is saying here." I'm looking over here because there I love the fusion of natural and spirit because we are. And I
Yeah.
think science, religion go beautifully together. I don't think they ever had to fight. I think the whole point was to use them both, that way you have it all and have strength from both sides. And so I
No, I
think
totally agree. I think they both complement each other perfectly. And it's not one side or the other. I think that there's some cases where, I think that, like modern, like I would say, I'm saying modern medicine, I'm saying traditional medicine may be helpful. And there's a lot of reasons why, spiritual medicine is also so important. We're not just a body, it's not just a shell, but, we're a soul on the inside as well. And so I think a combined approach is always one of the best approaches.
Preach. That's just the devil, that gets inside of people, making them want to fight like that. Making one side feel like it has to prevail over the other. Because when he does that, then it causes them to lose out on having the full buffet that they could.
Yeah.
They want to say this end of the buffet has to be better than the other one. Then they'll be blinded to the fact that there was benefits the whole time. But
Yeah,
that
and and interesting enough, there was a this is when I was a med student. There was a study which was in JAMA, which is like a big medical journal, and they look at the power of prayer. Actually, they look at the power of prayer, and it was actually a scientific study where they use all this scientific criteria, but they found that the power of prayer was very strong. It was significant. It was a significant, statistically significant difference with with patients that had someone praying for them. So there's definitely that side that's so important. And prayer can mean, it's, as you know, so many different things and so many different actions, and it's a beautiful thing, I think.
Yeah, the clairvoyant who raised me, she always used to say that prayer changes things. Prayer changes things. How did they qualify that in that study? That they tracked some statistics for a while,
Yeah,
or
it was statistics. It was a long time ago, and to be honest, I remember the conclusion. I don't remember all the methods that, like, with the detail and the methods, but as someone that, when I was younger, I'd go to, went to traditional church all the time. I found that to be fascinating. So these clips of, these articles are kind of running through my brain and everything. And when a patient says, and I don't do any general urology anymore. I focus on, sexual medicine and everything, but especially when I did general urology, and the person's diagnosed with cancer of some sort, and they're saying, I'm going through all these chemotherapies, and you think prayer will help? I'm like, yeah, I could say that 100% it can. And so it's like I said, it's the other part of it, not even the other side of it. It's like the other part. It's like the A and the one. I think they're both equally important. And so, yeah, but to be honest, I don't remember the details of the study. I just remember it was a large study that looked at these, and it was the study, they call it alternative forms of medicine, and prayer was one of them. So it was pretty cool. It's pretty cool.
yep, prayer changes things, y'all. Okay, so let's get over into this HuffPost article and talk about us some good old masturbation.
I
Title.
get all the articles. Let me tell you, and when people say stuff, people just, it's like all these papers, somehow they find me, it's like, I had one on like pre-cum the other day. Some star said something about pre-cum, and then this Jimmy Kimmel thing came out, and Jimmy Kimmel's like, shouldn't masturbate because it just takes your mind off of stuff. And so, it's somehow like I'm the expert on these, like, these things that are out there. But I love it, to be honest with you. I like to try to answer questions that everyday people have, so it's cool.
Girl, and let me just read this title. So the title of this article, and this just came out on the 8th of this month. So this is only like a couple of weeks old. I will post a link to this in the show notes. The title of it is Jimmy Kimmel says single men should stop masturbating. Here's what experts think. And so basically in this, let me just read it. It says, when asked by the host whether he had any suggestions for people struggling to get into a relationship, Jimmy Kimmel said, really, what kills you, and I think especially for guys, is masturbating. Jimmy continues, if you got a, not so great buffet at your house, you're not going to go out for meals. And I think that, a lot of people get caught up in their world of pornography and they lose a desire to procreate. Jimmy added that he'd advised two of his single male friends to stop masturbating for a month, after which point he said they found their wives. Then we get Dr. Gittens coming in here. It says HuffPost UK spoke to urologist and sexual health expert Dr. Paul Gittens and a sexologist, and then another doctor, Dr. Hargens, who gave advice in this article. Dr. Gittens, under the section title, What's the Verdict? Dr. Gittens told HuffPost UK, Jimmy is correct in the fact that anything that is overused or overdone can cause side effects. He is incorrect to say all men will not have the desire to be with a partner if they masturbate. So Jimmy Kimmel has said, if you wank it too much, you just want to go out there and find a wife or boyfriend or whatever. You just want to stay home and wank it all the time. You're saying not so much.
Yeah, I mean, I think it'd be fantastic if everybody, who's looking for a partner, they just stop masturbating for a day and then they find a partner the next day. That'd be fantastic. I mean, listen, I'm in, right? For that. A lot of my partners who are looking for a lot of my patients who are looking for partners, they'll be happy. Masturbation is one of those things, it's one of those things that I feel and a lot of experts feel that it's healthy, right? There's a lot of benefits that come from it. Like in the brain, all these great neurotransmitters that are like released like dopamine and like good serotonin and like all these great things that can help you relax and everything. So it's a great stress reliever. It's a way for a guy to kind of understand their body a little bit. Like, I always tell all my patients that it's hard for you to understand what you want and to have your partner just like magically understand what makes you feel good if you don't understand what makes you feel good, right? If you're a male, female, whatever, right? You got to know what makes you feel good. What turns you on, right? So I think masturbation is one of those things that can help with men or women. I also think that, I think that some of what he's saying, I understand what somebody was saying, that there are some people that are addicted to pornography and that is their life. They're watching pornography and they're not, looking for a partner. I think that is on the other side, right? So everything, if you do something too much, then it could be, it could be not beneficial. So, but in general, I think masturbation is something that is healthy and that's something that so many people do. And I think it's a good thing.
I'm digging your point of view. I'm glad that you're thinking about so deeply about something like this that can be so often brushed under the rug. It was not discussed in my household. The church told me just not to do it at all. And then that was the end of that. And so, of course, that didn't work. I had to, had to do something because my body doesn't work that way. Like I generate I like an insane amount of cum. And if I don't pretty much masturbate at least once a day, this whole blue ball thing is like real and it is painful. And things like swell up down there. I can't take no month off of masturbating. I'd be bent over, then you'd find me frozen on the side of the street somewhere.
I gotta look back through your shows and I gotta see when you're like a little bit irritable. I'll be like, oh, that's what happened. He didn't masturbate during that show. What happened, right? So, but yeah, and people feel that way, and if you don't have a partner, if you do have a partner, it's still healthy. Obviously, I mean, it's obvious, right? If you're doing it all day and that's the only thing you're doing, the only thing that you're focused on, then that's a little different, right? And that's when we have to kind of come in and say, hey, listen, let's try to do something different, so.
Yeah, I don't like the way Jimmy, I like Jimmy personally. I don't have a problem with Jimmy as a comedian though. I'm like, at one part of me is like, why the fuck are you talking about masturbating and giving your friends advice on like relationships and things like that? But they're friends, whatever. I was kind of like, why are you talking about? But nevertheless, he said what he said. So now,
Yeah,
so
he
now,
probably said it out of jest, it was one of those things that.
so now we have an opportunity to say what we say. I don't like how he took it right to procreation and relationships. Sexual energy comes from the divine, it comes from God, and it's like potential energy within us. And then we can use it in many different ways. It could be masturbating, it could be dating, it could be creating art, it could be writing a book. Sexual energy is potential energy. It is not kinetic until we decide to do something with it. And it does not have to be directed to a person at all. And and it does not have to necessarily be used towards procreation. His answer has this tone of a necessity to find a partner.
Yeah.
It almost has this tone of making that like more important than being single, which is not true. Not every experience is for everybody to have. It might not be for you to get married, or it might not be for you to have a relationship at all or to have children. That is not the ideal life for everybody. And then people go run out trying to force that to happen, and they end up in these relationships that they hate because it's never was what God wanted for them in the first place. So I
Or
don't.
maybe they should have just masturbated more. Right? Right? I'm just saying. But yeah, you're absolutely right. It's taken from one point of view, and I don't know the whole context of the interview or where it came from or anything like that. So, yeah, I don't know where like his what his thought process was, but I just like to comment on these things in general because so many people have these, so many people have these questions about, sexuality and masturbation and everything. So I think it's a good entry into it, to be honest with you, and it opens up discussion, and we have these discussions like you and I are having, and so I think it was, I think it's a good thing that he brought it up, because now we can talk about. Now we got a show about masturbation, right? We're like, so so that's the way I think. It's like, it's an opportunity. It's an opportunity for us to kind of, for you to educate your listeners, for me to, educate my patients about this. Like you said, like in a lot of households, it's not talked about. I have patients that are ultra whatever religion they're in, right? And it's not talked about as well. Actually, it's shunned, And I have patients that have hidden their whole life about masturbation, and they come in and they're, when they masturbate, or even if they started having intercourse with someone that they're not married with, they feel shamed and everything like that. So, these are all like, somebody's going to be helped by this conversation, and somebody's going to reach out to someone and maybe get some help or what have you. So I think it's great.
Amen and amen to that, brother. So, okay, speaking of these overly religious households and having grown up in a one or a household that's not even overly religious, but perhaps quieted by narcissism or whatever sort of shadow might be hanging over it, where things, the truth, it just doesn't come out. There is nothing wrong with masturbation. God don't care. Masturbation, I done been through the scriptures that they try to use to try to control this. There is nothing wrong with it. If you have a son, he gonna have a dick. It is gonna start getting hard. Tell him what he can do with it. That he's gonna do like I did and start running around the house finding random ass shit to stick his dick in.
Yeah.
With no stuffed animal was safe, no pillow was safe.
Yeah.
I got to experimenting because there was no adult telling me when I was 13 or 14 or in the 6th or 7th grade when I started popping boners what was going on. So do not abandon your teenage son or earlier, he could be younger than that, and just leave this boy to figure it out on his own or to have to turn to porn or his friends at school. You have an obligation.
Well, I think that, parents or providers, whoever that might be, I think they do. I think you have to be comfortable with yourself first, right? And I think, especially, I find that when patients come to my office and they tried to talk to a physician about, having issues, having some kind of problem sexually or whatever, and they get kind of rushed out of the office. And I always think to myself, maybe that physician or that person just wasn't comfortable with their own sexuality, right? Because you have to be comfortable with your own sexuality before you can kind of talk about it and to ask the right questions and not feel embarrassed about it. When somebody comes to my office, I just like we talk about like orgasm, we talk about all the things, massive everything, and it just comes out and it's very natural, but it's because I do this every day and I'm really comfortable with like myself, I feel as a man, but also in my craft as a physician. So taking it back to the home, I feel like, it's difficult for some parents or providers to be able to kind of bring this up because maybe they don't feel comfortable themselves. And so it's got to be, so they have to be educated. They have to be educated on, how to bring it up to their whoever they're talking to, if it's male, female, whatever, right? They have to be comfortable in talking about it, or they can send somebody so they can have their a family member that can talk about it too, or find some kind of resource. But I think it is important that we talk about it when you're younger because what happens is that person goes out into the world and they don't know anything about their penis or their vagina, and you know what that can lead to, you know? So I think we gotta talk about it. I mean, I have a daughter, and, it's and she's probably gonna be embarrassed if she sees this, but, like, when she was younger, I would say that, these are your breasts, they're gonna grow, and, like, you're gonna have, we call them boobies, you're gonna have boobies, all this stuff. And
Mhm.
so, for me, I talked about it when they were younger, so now she's older and I talk about it, if it comes up, she's not embarrassed, right? But it has to be age appropriate for one, because if you go over their head, they're gonna also be, like, ashamed and embarrassed. So it has to be age appropriate depending on what age they're at, their maturity level as well. That's all really important. But I agree. I think that we should have those discussions at home. And your first experience shouldn't be, a boy or a girl forcing you to have sex and touching your privates or whatever. That shouldn't be your first experience, in my mind.
Sex starts so early, and then the way music and media is, pretty much as soon as you put an iPad in front of a child, they have exposure to sex. And so in my opinion, soon as they're born, start telling them something I don't even know. I mean, because if you don't, then the devil is gonna get ahead of you and start putting little things in that kid's mind, and one of the main ways that Lucifer destroys people is through misuse of sexual energy, and because it feels so natural, it's difficult for people to understand when they're using sexual energy and getting themselves in these sexual situations, and it's damaging to them because it feels so sensually natural, for people to understand that everything that is sensually stimulating to the body is good. It just depends on all the different variables. On masturbation by itself, I'm curious, like physically, like can is it damaging to the male if we masturbate like too many times, say like back to back? Like one time when I was a teenager, I was like super like, watching porn and all this stuff. And I think I masturbated like 4 times like, in a row back to back, and I wonder, like, is it possible for one to hurt oneself, like, physically?
No, I mean, I think it depends on the aggressive. So I have guys that also depends on the style of masturbation. So, we always think that, all right, somebody's using their hand and they're kind of going up and down on their penis, right? But there's other people that masturbate on their bed. They'll lie on their bed and they'll kind of grind the bed. There's other people that may use some kind of tools to masturbate. So, depending on like how you're masturbating, how forcefully you're masturbating, then it shouldn't cause any harm, right? But there are harmful ways to masturbate. I had a guy that was like he literally had a hole in the wall, and I don't know, you know, I was a little worried because I'm like, all right, was it plaster wall? Was it like drywall? Like what's going on? And so obviously like, I worry about things like that. I have some guys that I don't know how he was doing it, but he was using like a tube from a tire, and like he had he had wrapped it around, and it was some like lubrication he wrapped around his penis. So, there's a lot of different ways to masturbate. It's not always the traditional way that you think of that you might have like, seen in a movie or what have you. So in general, masturbation is not going to hurt you. But like I said, excess is, anything on an extreme could cause some damage, right? So if that's all you're doing all day, I would worry about other things, like why you're doing it. Are you lacking other things in your life? And then we would try to, I don't go into that deep, but I would refer you to like a sex therapist or what have you that can kind of, especially if it's something that if it's somewhat of an addiction for you and you feel like it's a problem, then yes, it will get you help. But in general, for masturbation, as I mentioned, it's very healthy, and it's no shouldn't be any problems.
In spiritual circles, we have this thing that we call intentional purposeful isolation. This is something that we do to, get closer to God, to recharge ourselves, to cleanse our energy, to detach from people. So one of the things that I did a lot when I've been in, like, this 2 years of, like, sexual isolation is a lot of masturbation, but mindfully so. Like, so that area has to do with, like, your sacral and root chakra a lot. And so, like, say if somebody wants to clear their sacral chakra, then that has to do with the color orange. So you put an orange light on, LED light, orange candle, sacral chakra music, which you can get like on YouTube or Apple or whatever. and then you masturbate to that sort of music, and then
Mhm,
they can bring in like a spiritual cleansing, like in that way. I just wanted
mhm.
to just say that real quick without without putting too much into that, because I wanted to comment on the whole porn thing from a spiritual perspective. Somebody like messaged me some time ago or left a comment on one of the YouTube videos trying to like defend his position against porn. So the thing that why I don't watch porn is for like spiritual purposes because everything has an energetic transaction to it. And personally, I think sex is not something that is supposed to be observed by other people. It's to me, it is a high magic, sacred ritual, to be, that is supposed to be used to honor God, honor the people doing it. I don't think it's something that's supposed to be used for entertainment. But because when you're watching people on TV, just having sex, it takes away the intimacy of it, how they met and all the beautiful things that you do before you get to that point, and it can miseducate people that that is what sex is, just this thing that you do, and they're not understanding the soul tie behind the scenes. And and then also just watching that there's always like a spiritual transfer that happens. Oh, I was trying to get this dude to understand is porn might not hurt you today. But the way devil energy works is it will step inside of you and leave these little seeds that sprout and hurt you over years, if not decades. And now your self-esteem isn't right. You can't actually relate and emote with somebody in a relationship. Or you're watching this girl get like jackhammered, and now you think every girl wants to get jackhammered like that. Like it can subtly mess with you like that, and then the problems won't show up till later. And so,
Yeah, I don't I think I mean, you're a lot more spiritual than I am, so, you know, you may know a little bit more about that than I do. I think there's a lot of reasons why people use porn, and I'm not sure about I don't know about, the spiritual ramifications of it, but we do know that it's out there and it's readily available, and a lot of people watch it. And they watch it for different reasons, sometimes they watch it for education. They're like, "Oh, I've never been with a woman and so or a guy and like, all right, what am I supposed to do?" Like because maybe they haven't been maybe nobody educated them about it or maybe they watch it because they just need to be able to kind of release some sexual frustration or what have you. So or they're just watching it because it's entertaining. I don't, why people or they want to get turned on and they need something visual when they're masturbating. So there's a number of reasons like psychologically and that people watch porn. I just think that once again, like too much is too much, and if they're watching it too much, you can like and as there is porn addiction and those people are just as addicted to porn as people are addicted to alcohol or drugs. It's a dopamine high that they get, and they always want more, right? You always want more. You see, like the two people having sex, then you need three people having sex, then you need three people and a dog having sex. Whatever whatever it is, So to excess, but do I? When I see people, I have no judgment. I've seen if you can understand all the things I've seen in my office, and for me as a professional, as someone that's out there to help people, like there's no judgment. I don't judge. I don't say this is something you can't do. We work with people. We try to meet them wherever they are, and then we help with their sexual dysfunction. And then if it's something that is a problem, then I say, listen, we got to get you to a therapist, and if you need help, that's my role. My role is not to judge or anything like that. It's really to help. Um, and that's how I view like sexual medicine. Like I said, I see, congressmen and senators that say one thing on TV and they come in, they tell me something totally different. Like we see the people from, people like my parents who are mop the floors to people that are some of the most powerful people in America. So my job is not to judge. It's to just to really help them and wherever they are.
right, I concur. And spiritually, my job is not to judge, but it is to make people aware of where they might have devil energy lurking and unknown risks they might not be aware of. And then they always got to make their own decisions. But it's the same, we advise our clients, our people, but they have to make their own decisions. But no judgment here either. In terms of the erectile dysfunction, I wanted to also say that, sometimes that can be, I wanted to ask you some of the reasons you see for that and also posit, well, not posit, but let you know that sometimes that's also like an energy blockage too. Coming back to like the whole sacral, you know, the sacral chakra region and have the energy center down there. I mean, this could happen from all kinds of ways. Sometimes if people have had too much sex with too many different people, because a person can be sexually active a lot and still have a closed sacral chakra. It
Mhm.
depends on how it works. And to clear it up, you got to go into isolation and get out of other people's energy and pray before God and all kinds of stuff like that. And but from your end, what have you seen that some of this erectile dysfunction coming from? Are there any implications to like people using sex apps or dating apps or things like that? Have you
I
noticed it?
mean, I look at it from this is where I kind of look at it more from the medical standpoint, and so we know that guys that have ED, we know that a lot of them will have like high blood pressure, high cholesterol, they have diabetes, a lot of inflammation, right? We know that they may have some issues with their hormones, or they may have some issues with nerves, they may have some scarring from too much trauma to their penis. They may have some issues with adrenaline, and they may have some issues with stress and some other issues in their life. So, we take it from all of those points and we try to figure out exactly like what could be causing it. And we try to diagnose it, and then we try to fix it on a medical level, on a medical level, because we know all these things that affect the penis can also affect other parts of the body. Like, we know that when you look at data and you look at guys that say, if you look at Viagra or Cialis, so Viagra, Cialis are medications that guys take for ED, right? And if you look at that at a period of time, and then if you move ahead like 3 to 5 years, you see those same guys that were prescribed Viagra and Cialis. Now they're taking medications for their blood pressure and their cholesterol, right? So we know that like when we see ED, we know that's usually kind of sort of the first thing to tell us that something's going on with the body medically, right? And so we know that it's a progression. When you look at guys that have ED, we know that if you look ahead in a few years, they're more likely to have a heart attack and a stroke. So we know that medically that it is an indicator of what could be going on with the rest of the body, at least medically. So that's the way I look at it. And we know that there are some risk factors that will predispose guys to having erectile dysfunction. And then there's like different types, like, you having a problem starting or keeping the erection. We always talk about initiation and maintenance of the erections. Yeah, obviously a partner is really important. Like, is your partner giving you a hard time about this? Because then that can increase your stress. Right. I have some guys where, their partners are saying like, listen, I don't even want to have sex if you're going to just fail, And if that's the case, that's going to make it harder for this guy to get an erection the next time. So we look at all these things and we try to say, all right, this is how we're going to fix this part of it, this part of the puzzle. We're going to fix this part of the puzzle. And then we're going to get you to have better erections in some way. So I take it from more of a medical standpoint than obviously you, which you're taking it from more of a spiritual standpoint, which is just as important, like we mentioned.
Child is happy to have both sides of the coin, the full buffet. We're gonna have it all here on the Sex Drugs and Jesus podcast, baby. Yes. Y'all, the base of your relationship is not supposed to be sex. Okay, the base of your relationship, you cannot build a real relationship on sex. Period. I just don't. Like you should not let nobody oppress you, disrespect you, insult you, or reduce you down to just dick. And
Or
that
vagina, or
or,
vagina.
or vagina things. Yeah, women are important, trans are important, but
Everybody. Yeah,
everybody's
everybody.
important. But I'm coming at this from what I felt like the spirit was telling me to focus on. But
Yeah, yeah, yeah.
or we can't talk about all three. Not in one
We
hour.
need a couple. We could need a couple hours. We need like a whole day for that.
Maybe I'll get with your assistant and then she can or we could just talk about like anorgasm and stuff like that. That's a whole hour right there with women. And
And men, we see a lot of men with anorgasmia. Yeah, we see a lot of men that can't ejaculate.
you
But you're
said
right. It's a lot of topics under this umbrella of things. And I know it's a lot of fun in my office. So we have I love my job, which is, I'm privileged to be able to say that. Not many people could say they love what they do. I mean, I love coming to work every single day and really helping people. Like it's just, I wouldn't want to do. I'm so fortunate. I come from an immigrant family, and my parents had to work their butts off, and and I don't think they love their jobs, and I'm really fortunate to say that I'm blessed and I can say that I love what I do.
I do too, man. And I thank God, Jesus Christ, and the Holy Ghost for putting me in this position. You're talking about very few of us who can smile like this and be like, oh, yes, I'm going to do what I do, helping people and doing all of that. I wanted to ask you, you said trauma to penis, and then we're going to wrap this up. When you say trauma to penis, like from what? This,
Well, I mean, there's some guys that can have like a penile fracture. Like if they have rough sex, they can have like a fracture of their penis. There's some guys that can develop like something called Peyronie's disease, which is scarring of the penis that is probably genetic and some trauma. So there's things that can happen to your penis that, it's sports injuries or what have you that can cause some problems with the penis that can lead to some trauma that can lead to some erection problems. So,
fracture. How?
well, it's not a bone. It's not a bone, but there is like an envelope around the penis that keeps everything together. And that envelope can kind of, depending if you're having sex. So if you're having sex with a partner and you go in the wrong place, or somebody kind of comes down on you in the wrong place, and you can kind of have a disruption of that envelope around your penis and have some issues that way. It's painful, I know, but it happens. It usually happens in the middle of the night, though. It usually happens like at 3 a.m. in the morning, you know, too much to drink or something. But it is something that happens.
Lord Jesus, help today.
I know, right? So many things to talk about.
So, all right. So, you do virtual appointments as well?
We do telemedicine appointment. You have to be in the state though, like the laws have changed, so you have to be in the state of, like, I can't treat anyone if they're in California. I can talk to them, and then they would have to come to the office, and we'd have to have a face to face with them.
Okay. Okay. Thank you so much, doctor. Before we wrap this up, I'm gonna ask you three dad jokes. I'd like to ask people jokes at the end, just kind of lighten the mood since
All
this
right.
matter
I
is
feel like the mood's been light the whole time.
it kind of has been, but usually it can get fiery, in terms of like the depth of it, it can go very
Yeah.
dark. But before I ask you the dad jokes, are there any last words of encouragement, advice, or
Yeah.
self-promotion or anything you like to say?
Well, I mean, I don't know about self-promotion, but I would just say that, if there's anybody out there that's having problems, and no matter where they are, there's always going to be there's somebody out there to kind of help. You may have to search a little bit further, if it's, sexual function, if you're in the state, I'd be happy to see you. But there's other people that are out there that they do this for a living. And so just don't give up if it's something that's important to you. You don't have to give up your sexuality. You don't have to give up your function. There's a lot of people out there that can help you out.
No, that felt like a warm hug on this cold.
I'm a warm hug, man. That's what I am. It's a problem, but I'm a warm hug. It's but yeah. So that's the biggest thing, because I see so many people that have gone helpless and hopeless for all this stuff, and so I just want to make that's more my message. So the self promotion stuff, like, I'm not worried about that. We're around, but just want people to know that.
All right, I got you on the promotions. I'm gonna handle you. I got you, boo. All
You
right,
know,
joke number one. Why do crabs never give to charity?
why is that?
Because they're shellfish.
Oh, that's good. All right. I got that's good. That's very good.
Okay, the
I
second.
like that one.
Thank you. I knew that you would. Okay, the second one is, why does the egg take the day off from work?
Something to do with the chicken, right? An egg day off from work. Tell me why.
Because it was Friday.
That's good. That's a good one. It's Friday. That's good. I like that one.
We'll survive. He's like, not
Yeah,
today.
yeah. Not
Time,
today.
not
Not Friday. Not Friday. That's a good one. I like that.
All right, then the last one. How many stormtroopers does it take to change a light bulb?
How many?
None, because they're all on the dark side.
Oh, I get it. That's a Star Wars joke. I like that one. You got to be a Star Wars person to understand that one, though.
Oh,
I'm a st-
yeah,
what?
I'm a nerd to my core. I'm like a really like super goth and like super nerdy.
Yeah.
People can't necessarily tell from the show, but I'm like super goth and super nerdy and also super magical. It's like a whole thing I got going on over here.
All right. All right.
So thank you so much for your time, Dr. Gittens. I look forward to editing this down and getting out there so the world can start reaching out to you to see what can be done.
Yeah. No, that's great. Yeah, we can. You know, at the end of the day, we want to make sure that we're helping as many people as we can. So it's fantastic.
All right.
All
Have
right.
a warm weekend.
All right. You too. Thanks so much.
Thank you all so much for joining us today and for taking some time to invest into yourself and into the lives of your loved ones. Please visit us at sexdrugsandjesus.com and check out our resource page, our spiritual service offerings, my blog, my books, and other writings that God has partnered with me to create. Find us on any social media platform. Stay strong, my people, and just remember that everything is going to be all right.